If you've been diagnosed with cancer and you decide to use chemotherapy, you should be aware that it can produce a wide range of undesirable side effects. Which side effects can occur depend on the type of chemotherapy, the dose and the timing of the treatments, the general health of the patient, and the history of prior chemotherapy. One of the problems with chemotherapy is it's active against all dividing cells, whether cancerous or not. This means that cells lining the intestine, in the bone marrow, and in the hair follicles, all of which are continuously dividing, can be damaged by the chemotherapy. Fortunately, there's some natural products that can be used to protect against the damaging effects of the chemotherapy, while simultaneously increasing its effectiveness. The natural ones are worth incorporating into your cancer treatment plan, and they might mean the difference between life and death. Along with some basic dietary guidelines, there's 5 key supplements that can be used to support any form of chemotherapy or radiation. A high-potency multivitamin and mineral, the regular consumption of green drinks, a Maitake D Fraction, Proteolytic Enzymes, and Curcumin. In addition, it's important to take coenzyme Q10 if you're taking doxorubicin or any other chemotherapy agent that's known to damage the heart. The problem of nausea and vomiting, sometimes caused by the cancer itself, as well as by the chemotherapy or the radiation therapy, can make people develop anorexia or a loss of appetite and desire to eat. This situation is not good, as it can lead to a condition known as cancer cachexia, a wasting syndrome that's characterized by weakness and a noticeable continuous loss of weight, fat and muscle. It's estimated roughly 40% of cancer patients actually die of malnutrition rather than the disease itself. The importance of high-quality nutrition in the battle against cancer cannot be overstated. Cancer patients who have higher nutritional status are better able to tolerate the cancer therapy and its side effects. A person on chemotherapy with poor nutritional status can lead to progressive wasting, weakness, and lower resistance to infection that can sometimes be fatal. The following dietary suggestions can help to improve the nutritional status in cancer patients. You should go ketogenic, as sugar makes cancer cells grow. Eat small, frequent meals every 1 to 2 hours. Drink a high-protein smoothie containing 20 to 30 grams of protein twice per day. Get a juice machine and drink 18 to 24 ounces of vegetable juice. Use extra seasonings, spices, and flavorings, but avoid flavorings that are sweet, bitter, or artificial. The chemotherapy can cause a change in taste and make food taste flavorless and boring. Eat soft or moist food while avoiding hard, dry food. Take small bites and chew completely. Drink at least 48 ounces of water every day, in addition to the 18 to 24 ounces of the vegetable juice. You should be consuming green drinks containing barley grass, wheatgrass, and algae sources like chlorella and spirulina. They're packed with phytochemicals, and these are especially helpful for fighting against cancer. They help to alkalinize an acidic body. If you're taking Coumadin, warfarin, or blood thinning medication, you should check with a doctor, as green drinks can be high in vitamin K. One of the most controversial recommendations to support chemotherapy as well as radiation therapy is the recommendation of antioxidant nutrients during the active phase of the treatment. While there's little concern with using antioxidant nutrients after the completion of chemotherapy or radiation therapy, the concern that many oncologists have is the antioxidant nutrients can interfere with the effectiveness of conventional therapies. However, the Center for Vitamins and Cancer Research at the University of Colorado Health Science Center, Department of Radiology in Denver, are among the most knowledgeable experts in the field, and they've stated the concerns over the use of high doses of antioxidants during chemotherapy and radiation therapy are not valid. They state, based on the results of the studies and others, we've proposed a hypothesis that supplementation with high doses of multiple antioxidant vitamins, together with a diet modification and lifestyle changes, can improve the efficacy of the standard and experimental cancer therapies by reducing their toxicity on the normal cells and by enhancing their growth inhibitory effects on the cancer cells. The bottom line is, in addition to countless animal studies, the majority of human studies have shown patients who are treated with antioxidants during chemotherapy or radiation therapy tolerate standard treatment better, have a better quality of life, and most importantly, live longer than the patients who are receiving no supplements. For example, the conclusion in a study in patients with small cell lung cancer using a combination of chemotherapy with doxorubicin, vincristine, and radiation, and a combination of antioxidants, vitamins, trace elements, and fatty acids, was the nutritional support significantly prolonged the survival time of these patients. While oncologists cite scientific evidence that antioxidants interfere with chemotherapy and radiation, they tend to ignore the fact the majority of these sorts of studies show predominantly beneficial effects. The scientific evidence that the oncologists often refer to consists primarily of animal studies, where they fed the animals, usually via an injection into the intestine, doses of an antioxidant that far exceed the amount normally recommended. For example, when vitamin E is given to mice at doses not likely to be achieved with normal supplementation in humans, example a dose that's 35,000 international units, it can reduce the effectiveness of radiation therapy. However, based on human and animal studies, vitamin E at commonly used doses does not interfere with the radiation therapy or the chemotherapy, and it actually appears to enhance the success of the treatment. The same can be said with coenzyme Q10 and many other antioxidants. The only real exception is N-acetylcysteine, a derivative of the naturally occurring amino acid cysteine. N-acetylcysteine has not been shown to significantly affect the treatment outcome, and it carries some risk of inhibiting chemotherapeutic agents. It's not recommended to use it during the active phase of the treatment with any chemotherapy. After the chemotherapy is over, however, the N-acetylcysteine can be of benefit in reversing any kidney or nerve damage. Since the immune system requires a constant source of virtually every nutrient, it makes sense to use a high-potency multivitamin and mineral formula. This can be the first step for supporting the immune system and the nutritional status in patients on chemotherapy. A deficiency in virtually any nutrient can result in significant impairments to the immune system, especially deficiencies of vitamin C, E, A, B6, B12, and folic acid. Minerals that are especially important are zinc and selenium. We know that zinc's absorption can be increased when it's taken with quercetin. The Maitake mushroom is a source of immune-enhancing compounds, and these are being shown to offer significant health benefits. In the early 80s, in Japan, the research showed the immune-enhancing properties of the mushroom, and then they concluded that the Maitake demonstrated more pronounced anti-tumor activity in animal tests than any other mushroom extract. One of the key benefits of the Maitake is its ability to be quite effective when given orally. In contrast, the other mushrooms studied, like shiitake, were only effective when injected into the bloodstream. In 1984, Dr. Namba identified a fraction of the Maitake that possessed a significant ability to stimulate the white blood cells known as the macrophages. These specialized white blood cells phagocytize or engulf the foreign particles, including cancer cells, bacteria, and cellular debris. The Maitake beta-glucan fraction appears to help to reduce the side effects of conventional chemotherapy and radiation, while at the same time enhancing its effectiveness. In 1994, a group from China published findings from a pilot study on 63 cancer patients, and they reported a total effective rate against solid tumours of higher than 95%, and the effective rate against leukemia higher than 90%. In preliminary studies conducted by Dr. Namba, 165 patients with advanced cancer were given the Maitake extract. In patients who were also on chemotherapy, 90% of the patients experienced a reduction in the side effects of the common chemotherapy, like hair loss, decreased white blood cell counts, nausea, vomiting, and loss of appetite. The Maitake was shown to effectively reduce pain levels in 83% of the patients. The results were best in the breast, lung, and liver cancers. Dr. Namba reported significant improvements in symptoms of regression of tumours in 73% of the patients with breast cancer, 66% in lung cancer, and 46% in liver cancer. The dose of the Maitake is based on the level of D or MD fraction. The therapeutic dose range is based on body weight, so 0.5 milligrams to 1 milligram for every kg of body weight per day. This translates to a dose approximately of 35 to 70 milligrams of the D or MD fraction. The dose recommended for prevention is typically 5 to 15 milligrams. For best results, take 20 minutes before a meal on an empty stomach. Proteolytic enzymes, or proteases, refer to various enzymes that digest, or break down into smaller units, the protein. These enzymes include the pancreatic protease chymotrypsin and trypsin, bromelain from pineapples, papain from papaya, fungal proteases, and Serratia peptidase, the silkworm enzyme. Proteolytic enzymes have a long history of use in cancer treatment. The clinical research that currently exists on proteolytic enzymes suggests significant benefits in the treatment of many forms of cancer. Clinical studies have shown improvements in the general condition of the patient, their quality of life, and modest to significant improvements in life expectancy. Studies have consisted of patients with cancers of the breast, lung, stomach, head and neck, ovaries, cervix, and colon, and lymphomas and multiple myeloma. These studies involve the use of proteolytic enzymes in conjunction with conventional therapy, such as surgery, chemotherapy, and radiation. These indicate that proteolytic enzymes can be used in conjunction with all the conventional treatments. Animal and vegetarian-derived proteolytic enzymes have slightly different effects, so it's recommended to take a mix of all the different forms. They need to be taken on an empty stomach. Curcumin is the yellow pigment of turmeric, the chief ingredient in curry. It's demonstrated significant activity in many experimental and clinical studies involving inflammation and anti-cancer properties. It exerts a complex set of actions that are beneficial for the prevention and the treatment of cancer. The anti-cancer effects of turmeric and curcumin have been demonstrated at all steps of cancer formation, initiation, promotion, and progression. The protective effect of the curcumin is only partially explained by its direct antioxidant effect. Other anti-cancer effects include its ability to inhibit the formation of cancer-causing nitrosamines, to enhance the body's level of anti-cancer compounds like glutathione, to promote the proper detoxification of cancer-causing compounds by the liver, and prevent the overexpression of the enzyme cyclooxygenase 2. The enzyme produces pro-inflammatory and cancer-promoting derivatives of essential fatty acids, prostaglandins, and the 2 series. The curcumin has demonstrated significant anti-tumor results in a number of experimental models of prostate, breast, skin, colon, stomach, and liver cancer. It's thought to have several mechanisms of action. 1. By inhibiting angiogenesis. The growth of tumors is dependent on developing new blood vessels to feed them. by inhibiting epidermal growth factor receptor sites. About 2/3 of all cancers overproduce epidermal growth factor receptor sites, thereby increasing the sensitivity of the cancer cells to the substance that stimulates the cell proliferation. By inhibiting the fibroblast growth factor. This growth factor promotes angiogenesis, the formation of new blood vessels that feed a growing tumor. By inhibiting nuclear factor kappa beta, or NF-kappa B. Many cancers overproduce this growth factor to escape arrest of cell proliferation. By increasing apoptosis, or cellular suicide of the cancer cells. By inhibiting enzymes within the tumor cells that promote growth. Doxorubicin is especially harmful to the heart, and it can produce serious damage, like cardiomyopathy. In fact, the damage to the heart is often life-threatening. A number of studies have shown that CoQ10 can prevent the cardiac toxicity that's associated with the doxorubicin, without reducing the anti-tumor effect. In order to enhance the absorption and the utilization of the CoQ10, some manufacturers have looked to synthetic compounds to enhance the solubility of the CoQ10. In a preliminary study, blood levels of CoQ10 at 6 hours after taking ClearQ produced an increase that was 235% greater than that was achieved by a standard CoQ10. Equally impressive is the fact that the blood levels of CoQ10 after 6 hours from taking the loading dose can reach above 2.5 micrograms per milliliter. Considered the blood level that's required in order to achieve consistent results with CoQ10. By providing the CoQ10 dissolved in vitamin E, the absorption is not only enhanced, but also the likelihood that the CoQ10 will remain in its active form. CoQ10 is present in the blood in both oxidized inactive and reduced active forms. CoQ10's effect can be enhanced by taking 20 mg of PQQ also. During times of increased oxidative stress or low vitamin E levels, more CoQ10 will be converted to its oxidized inactive form. Thus, by providing high levels of pure vitamin E, the biological activity and the function of the CoQ10 is enhanced. In addition, the CoQ10 actually enhances the vitamin E activity also. For people on doxorubicin, it's recommended taking the CoQ10 with the vitamin E to prevent the negative effects of the doxorubicin without decreasing its therapeutic effects. Other supplements are indole 3-carbinol, or I3C, at a dose of 300 to 400 mg per day, and calcium D-glucarate at a dose of 400 to 1200 mg per day. The I3C is one of the chief anti-cancer compounds from the cabbage family. The I3C is especially protective against breast, prostate, and cervical cancer because of a number of actions, including its ability to increase the breakdown of estrogen. Preliminary studies have also shown taking the I3C as a dietary supplement significantly increased the conversion of estrogen from cancer-producing forms to non-toxic breakdown products. Calcium D-glucarate is also important because it inhibits an enzyme in the gut that interferes with the elimination of excess estrogen. One of the key ways which the body gets rid of estrogen is by attaching glucuronic acid to the estrogen in the liver and then excreting this complex in the bile. Glucuronidase is a bacterial enzyme, and it uncouples the bond between the excreted estrogen and the glucuronic acid. By inhibiting this enzyme, the calcium D-glucarate promotes the excretion of the estrogen. Another important recommendation in breast or prostate cancer is to consume ground flaxseed. Flaxseed contains an important group of anti-cancer compounds known as lignans. The flaxseed are easy to grind with a coffee grinder, food processor, or a blender. It's recommended to have 1 to 2 tablespoons per day and add it to foods such as cereals, salads, or smoothies. While it's better known that the flaxseed lignan can prevent and even shrink breast cancer, the flaxseed lignans also bind to male hormone receptors, and they promote the elimination of testosterone. In a study of men with prostate cancer, a low-fat diet that was supplemented with 30 grams of ground flaxseed reduced the serum testosterone by 15%. It slowed the growth rate of the cancer cells, and increased the death rate of the cancer cells after only 34 days. To learn about more natural cancer treatments, herbs, supplements, or to book a consultation, check out my website.